When the clients arrived in our clinic, we always ask them to do specific motion and movements to find out if anything wrong with person, if anything range of motion increase. And this is what we do. All right. And our first test is called Who's There? We want to see how our upper body is moving around. So thoracic area. And we're going to place the, hands on the shoulders and ask Marina to turn around as far as possible and look through these hands. So we were looking for 110 degrees on the both shoulder. I will show you this on diagram. And go ahead and turn to the right now. Go to neutral first and go ahead, turn to the right. Yes. Which side is you feel more easier?
Left.
You feel go easy to the left. Yeah, and I can see a little bit of restrictions on the left. So it's always good ask like what side is easy to turn. Do you feel any pain, experience any pain?
No.
Good. So this is questions have to be asked. If person experienced the pain, sometimes you can see you can let it go, your arms. You can see this functioning. The person is turned without any problems, but he experienced pain, but he never gonna let you know. But if person feel the pain, this is mean it's not functional. This is the worst scenario when you operate it with the pain. Just remember this. Do not operate with the pain. If something hurt, that means something not working right, correct? Okay. The next one, it's, if we're going to turn this way, turn around. So feet always together. And I'm going to ask, Marina, touch her toes. Just look straight forward and to your toes and try to touch. She touched it good. What I'm looking for is a nice rounded area in the spine. And if she shifts weights, go ahead, come back again. And you can see she's shifted weight perfectly. We can also take this angle of sacrum, supposed to be 70 degrees. Go ahead, do it again. No. Go touch the forward. I just want to show people how this, you shifted weights. Perfect. Shift that whole body back. It's a little bit kind of not rounded, you can see, and this side is a little bit more like slide away. Always look around. If people can do that, it's already tell you something going on. Does it feel any pain?
No.
Great. So this is another test. Okay, the next one, we see the squat. In squat, we can tell if any problem with lower back, hips, and ankle. If person start collapsing forward, that's mean he have a maybe ankle problem or lower back pain. Let's see if any pain. So go ahead, get your hands in front of you and go ahead, deep squat. Deep squat, perfect. No problem, touch the ground and go ahead and raise up. Go up. You can go up? Okay, no worries. No, just go up now. Perfect. Do you feel any pain?
No.
No, what was that like? Oh. It wasn't uncomfortable? Which side was uncomfortable?
This side.
So always ask your clients if any side was uncomfortable. Most people, what they do, let me show our patients. You can let it go, your arms. So what most people do, they start leaning forward this way. That's mean we have a hip problem and lower back. And sometimes people feel pain. Sometimes people doing this, they're leaning, they raise the heels up, that means something wrong. So this is couple, the next one, we want to see the balance, how single leg stances work. So what I'm going to ask Marina, we're going to raise this knee up and stand, just like that. And we count to 10. 1, 2, 3. Let's see if she's shaking, if something happening. And go ahead and lay down, put it down. And go ahead, raise your left leg. Let's see how she shifts weights all the time. Yeah. And you can see this one. Yeah, 10, let it go. You'll count to 10. How do you feel? Which one is weaker for you? Which one is difficult to stand?
Stand on this one. This one's what's shaking more.
So when you stand on your right, you shake more.
Yeah.
So this is going to tell me something. If she's standing on her right and she's experienced a little bit unbalanced discomfort, something really going on with the ankle or hip, we have to find this out. Like I said, this is first couple moves. You can tell your customers to do to find out it's something wrong? If people solid doing all those tests and nothing wrong with that, this is great. They're great conditions. And now we're going to just break the person down and we start with the neck. First thing, of course, flexion, extension, and neck rotation. Just don't forget, we don't do side bending because this can cause a little bit problem with your neck. You don't want to jam your C3 nerves. So the first one, we're going to turn to the camera this way, put the feet together, always feet together. And what we check right now, we check the neck flexion. Ask the client, close the mouth and tuck the chin and touch the sternum and see if she's able to do it. And she's not able to do that. You see, I can feel the space up there. She tried hard right now, but that's okay. Do you feel any pain?
No.
She don't feel pain, but she'll limit it. Okay, go ahead, come back. Yeah, it's maybe because a lot of gold chains up there. That's why. And now we're going to do extension. So, extension, we're looking for 80 degrees. So you're looking for chin and nose right and eyebrow. So you put the arms like this and you see the 80 and it's perfect. It was 80, perfect 80. Do you feel any pain? Experience any pain?
No.
This is great. So if person limited and can go to this touch the tuck the chin. Yeah, I know. Tuck the chin and extend. That means something going on within the cervical area. And if this is pain present, definitely we want to work on that area. So now we're going to go ahead and turn to the right. What we're looking for in any compensation, and we're looking for 80 degrees. So basically this, the chin, the middle of the chin have to reach the clavicle bone and see if this is possible. You see she start bending already. Is any pain?
No.
Okay. So, and go ahead, turn to the left. Let's turn to the camera first. And turn to the left. You see this kind of, the head is come this way, and she's kind of struggling. Is there any pain present?
No.
This is good. She can able to do that, but she don't experience pain, which is, she just limited. We have to find out, is that the radial motion? Is that the mobility problem or is it a motor control problem? And this is, of course, we have to find out on the table. The next one, we're going to check our shoulders. Okay. You're going to turn to the side, and the first test, you're going to place your hands on the shoulder and ask the client, raise your elbow as far as possible. Do you feel any pain?
No.
She's good. So basically, if she's raised close to the elbow, to the nose, and no pain, it's great. Let's switch. You always hold. Yeah, you can pulse like here. You always hold for the compensation. And how's it feel?
Good.
Perfect. Next one, we're going to see the shoulders. It's all due in standing position. So now we're going to show Marina. I want you to squeeze your fist like this. And go feet always together. You see, feet together. Yeah. And now you're going to try to bring them as far as possible in the back. Okay. One motion and let's switch. You see, she's, no. Always hold your fist. Try it again. I mean, you're good. Here we go. One motion. Okay, that's perfect. And switch. Excellent. What are you looking for here? Come up here. You're looking for the distance, the palm. She's a little bit, now show for the camera the other side. You see this one, a little bit compensation here, and it's actually less space between, when the right arm is up, it's less space in the back because we have scoliosis, right? This is important to check both sides. What we're looking for, if the space of the client's palm, you measure this way, you measure the palm of the client's. And so I measure her. It's probably like half of my hair. So this is what I'm looking for. That was perfect. But sometimes people, you can see when they do that, let me show for the camera. You can stay right here. People doing this, and that's the distance. It's not good. So, and sometimes they start twisting to the side, they're bending to the side. This is going to tell you something going on with the shoulder, mobility, thoracic mobility, or neck. So we have to find out. We have to break this down. And this is our mission to find out what's wrong with that.